Let's discuss this clinical scenario. A term baby presented on day 4 with bleeding PR. Baby was diagnosed as a surgical case, taken to the OT, found malrotation. The CRP was high preoperatively, and subsequent to the surgery, the CRP reduced, but it was marginally reduced. So the question is, how long do we treat this case with antibiotics, and how do we monitor the inflammatory markers? So obviously gut necrosis due to malrotation and volvulus would have caused a high inflammatory marker in this case. It's of course important to give antibiotics for such cases. A broad spectrum antibiotic including the gram-negative and possibly anaerobic cover is important. So most units would use either piptaz, amikacin or meropenem, depending on what choice. I mean, if you're giving meropenem, there is adequate anaerobic cover, so you don't need to add metronidazole. The drop in inflammatory markers post-operatively is challenging because the surgery itself causes a rise in inflammatory marker. So you might often notice that the CRP rises significantly. It's an inflammatory marker, it's not specific for infection. So the surgeons usually give at least 7 days of treatment, and subsequent plan would depend on the clinical improvement in the child. Of course, by 7 days or so, you would see a more significant drop in inflammatory marker if the baby is clinically improving. And you might have started trophic feeds, depending on what surgery was done and whether you needed a second study to review the gut before you start feeds. So you wouldn't blindly go by inflammatory marker in this setting. You would just use it as one of the corroborators, and especially in the first 3 to 4 days post-op, you wouldn't use it at all. You would only start considering it after 5 to 7 days, but most of these babies need antibiotic for that duration anyway. And obviously, if you have any positive cultures, you can rationalize or optimize the antibiotic cover, reducing the spectrum. So I hope this is helpful. Do mention your comments in the chat as well, and hopefully we'll learn from each other.